You're watching WKBN 27 First News, where your news comes first. Now, in high definition.
Welcome back. Time now for our Live at 5 segment. And joining us today is Dr. Michael Sevilla with Salem Community Hospital. Thanks for being here today.
Hello.
And we're talking about breast cancer because this is Breast Cancer Awareness Month. And I know in the last 5 or 10 years we've come so far with research and being able to prevent and treat breast cancer. What is the impact of breast cancer today in light of all of that?
Well, the latest statistics that we have right now are from 2006. And from those statistics, about 190,000 women were diagnosed with breast cancer, and also during that year about 40,000 deaths. What they're saying now, about a 1 in 8 lifetime chance of being diagnosed with breast cancer.
So it sounds like pretty much in any household, you some way could be impacted by it, knowing somebody, a friend or a family member that's affected by breast cancer. What are the risk factors that women should be aware of?
Everybody talks about family history, but when we break down the details, about 20% of women have a family link to breast cancer, but it's still a very important risk factor. Other questions that I get in my office are there certain vitamins or diet, or is that linked to breast cancer, or birth control pills? But there hasn't been a definite link to those in the studies. But what we do know is that exercise does decrease the risk of breast cancer.
So is there any one thing that people should be aware of that could be the biggest risk factor, or they just haven't determined that yet?
Well, I think that with education that has gone on over the past few years, people are learning the different types of risk factors. I think family history is a key risk factor there too. So
what can women do to prevent that if they have a family history of it? Is it just in the genes, or are there things that women can do to prevent it from happening?
Probably the most important thing to do is to visit your doctor, have your exam, and getting your mammogram done too. There's a lot of questions about when to get the mammogram done, whether at age 40 or age 50. Definitely age 50, but before that, talk to your doctor, know what your risk factors are for breast cancer, and then you can talk with your doctor about as far as testing and screening for breast cancer.
So if you are at higher risk, then maybe your schedule for how often you should get checked out would be a little bit more frequent.
Yes, it would be, because then you could detect maybe a breast cancer earlier, and but that's something that definitely women should talk with their doctor and work with their doctor as far as when to get that testing done.
Great. Thank you so much for joining us today. We appreciate your time. And if you're interested, there are a lot of events that happen this month to support and raise money for breast cancer research. You can go to our website, WKBN.com, to find out more about that. We'll be right back.